Welcome to another deep dive. We are really thrilled to have you here with us today. Whether you are, prepping for a demanding meeting or maybe just winding down after a really long day, or if you simply have that kind of insatiable curiosity to understand how the hidden mechanisms of the world actually operate, you've definitely found the perfect place to be.
Absolutely. It's a great topic today.
It really is. Today, we're bringing you a pretty fascinating exploration straight from the archives of the iMedix platform. And if you aren't familiar with iMedix, it's this independent medical information database and just a truly remarkable educational resource. The
Mm.
entire platform is built around this one singular goal, which is helping you better understand incredibly complex treatments.
Right, and navigating patient safety.
Exactly. Navigating the often confusing landscape of patient safety and basically decoding the absolute mountain of medical information that's just out there on the internet. We constantly find ourselves drawn to their research because they refuse to just hand you a sterile bulleted list of facts.
Which is so common these days.
Right. They actually provide the deep context, the underlying mechanisms, and the human element behind the medicine.
And I think the context is always where the true value lies.
Yeah.
But before we go any further, I do need to quickly mirror the core disclaimer from the iMedix platform. Everything we discussed today is strictly for educational and informational purposes.
Right.
This conversation does not replace professional medical consultation, diagnosis, or treatment. No one should ever self-medicate, alter a dosage, or change their medical treatment plan based on a deep dive discussion. Always consult with your doctor or a qualified healthcare professional regarding your specific health situation. Knowledge is an incredibly powerful tool, but it's only truly valuable when it's applied safely and under proper medical supervision.
Yeah, beautifully said. So with that vital foundation laid out, let's look at today's focus. The topic sounds almost like a prop from a superhero movie, or maybe the name of a heavily caffeinated energy drink. We are looking at a medication branded as Viagra Super Active.
Is quite the name.
Right. Underneath that flashy branding, it's actually a specific formulation of sildenafil citrate. Hearing that moniker super active, it immediately sets off a sort of, I don't know, a marketing alarm bell for me. It sounds designed to sell speed and power, which makes it the absolute perfect candidate for us to unpack today.
It's ripe for analysis.
Definitely. Our mission for this deep dive is to look way past that glossy branding. We really want to understand the actual granular pharmacology, the real safety profile, and the highly surprising realities of this specific medication.
And to do that, we're going to explore how this drug fundamentally alters physiological processes on a cellular level. We'll look at the critical regulatory nuances, including the very surprising fact that this specific formulation currently carries a not approved status.
Which is wild.
It is, and we'll delve into the very real, often hidden dangers of the counterfeit pharmaceutical market. It's really a complex narrative about modern medicine, the pursuit of optimization, and the delicate balance of human biology.
Okay, let's unpack this. Let's start with the physical reality of this drug, because if you are picturing the classic, iconic imagery associated with this medication, you are likely picturing a small, hard, diamond-shaped blue pill.
A classic Pfizer image.
Exactly. But Viagra Super Active completely discards that recognizable design. According to the detailed physical descriptions in the iMedix database, this specific medication is formulated as a liquid-filled softgel capsule.
Right.
It's described as amber-colored and oval-shaped. So right out of the gate, it physically distinguishes itself from the standard pharmaceutical baseline. But this isn't merely an aesthetic choice by a manufacturer just trying to look different on a pharmacy shelf. There's a deeply functional, mechanical reason for this change in form.
There is, and the physical formulation is really the entire basis for that super active claim. The scientific literature refers to this delivery method as liquid core technology.
Liquid core technology. Okay.
Yeah. And to understand why this matters, we have to look at the mechanics of human digestion.
Yeah.
When you swallow a standard, hard, compressed tablet, it enters the highly acidic environment of your stomach.
Right.
But before the active ingredient, in this case, sildenafil citrate, can even begin to be absorbed into your bloodstream, that hard tablet must undergo a mechanical and chemical breakdown.
So it has to physically fall apart first.
Precisely. The stomach acids and the churning of the digestive tract have to dissolve the binders and the fillers holding the pill together. That mechanical breakdown inherently takes time, often 30 minutes to an hour, depending on the individual's metabolism.
So the hard tablet is essentially creating its own delay. It has to be dismantled before the actual medicine is freed up to do its job.
That is the crucial bottleneck. By taking that same active ingredient, sildenafil, and suspending it in a liquid core inside a soft gel capsule, the manufacturer is essentially attempting to skip a major step in the digestive process.
Skip the dismantling phase. Yeah.
Exactly. The gelatin casing of a soft gel is designed to dissolve incredibly rapidly in stomach acid, often within mere minutes. Once that thin casing dissolves, the liquid medication is already in a state ready for absorption. It doesn't need to be broken down from a solid mass.
Right.
It flows immediately against the mucosal lining of the digestive tract, allowing the active chemical to cross the biological barrier into the bloodstream at a much faster rate.
It's kind of like the difference between trying to absorb a block of ice into a sponge versus pouring a glass of water directly onto that same sponge.
That's a great analogy.
Yeah, the ice block has to melt first, which is the slow, gradual release. But the liquid core soft gel is like the glass of water. It just hits the system and gets absorbed with much less friction. So once that liquid's sildenafil crosses into the bloodstream at this accelerated rate, what is it actually doing? I really want to get into the specific mechanics of how this drug functions inside the body.
The mechanism is a really brilliant piece of biochemistry. Sildenafil citrate belongs to a specific class of drugs known as PDE5 inhibitors. Right. PDE5 stands for phosphodiesterase type 5. It's an enzyme found in various parts of the body, but it is highly concentrated in the smooth muscle cells of the blood vessels, particularly within the erectile tissue of the penis.
Okay, so it targets these specific muscles.
Yes. And to understand what blocking this enzyme does, we need to look at the natural physiological chain of events. When a male becomes sexually aroused, the body releases a signaling molecule called nitric oxide into those localized blood vessels.
So nitric oxide acts as a sort of chemical messenger, basically telling the vessels what to do next.
It does. The nitric oxide triggers the production of another substance called cyclic GMP, or cGMP. Think of cGMP as the actual key that unlocks the smooth muscles in the walls of those blood vessels.
Unlocks them, meaning it relaxes them.
Exactly. When cGMP levels rise, those muscles relax. When the muscles relax, the blood vessels widen significantly, a process called vasodilation.
Vasodilate.
Yes. This rapid widening allows a massive influx of blood into the erectile tissue, which is what creates the physical erection. Now, the body's designed around balance. It doesn't want those vessels to stay wide open indefinitely.
That would be bad.
It would be very bad. So it deploys that PDE5 enzyme we mentioned. The sole job of the PDE5 enzyme in this scenario is to break down the cGMP, ending the relaxation, constricting the vessels back down, and returning the tissue to a flaccid state.
Oh, wow. Okay, this brings the mechanism of the medication into perfect focus. If the PDE5 enzyme is the cleanup crew trying to shut down the vasodilation, sildenafil comes in and essentially locks the cleanup crew in a closet.
That is a highly accurate, if slightly dramatic, way to visualize it.
That's right.
By inhibiting or blocking the PDE5 enzyme, sildenafil prevents the breakdown of cGMP. The levels of that vessel-relaxing molecule remain artificially high, the smooth muscles stay relaxed, and the blood flow is drastically improved and maintained. It is a localized, highly targeted chemical intervention.
I want to highlight something really crucial you just said, which the iMedix sources are also very, very adamant about clarifying for patients. This works locally on the vascular system. It's a hemodynamic process, meaning it deals strictly with the physical dynamics of blood flow.
Correct.
It is absolutely not a hormonal therapy. There is this very pervasive misconception out there that drugs in this category are somehow pumping the user full of synthetic testosterone or artificially revving up the endocrine system to create a heightened state of virility.
Dispelling that myth is absolutely paramount. Sildenafil has strictly no direct effect on the endocrine system, the brain's libido centers or systemic hormone levels. It doesn't increase desire, and it doesn't manufacture arousal.
It's just plumbing.
It is strictly a mechanical facilitator for the vascular plumbing. And understanding this completely dismantles one of the most common, almost comedic myths surrounding these medications, the spontaneous erection myth.
Right, the whole cinematic idea that someone accidentally ingests this pill and suddenly, regardless of where they are, what they're doing, or what their mental state is, their body just forces an uncontrollable physical reaction.
The biochemistry simply does not support that scenario at all. The medication strictly relies on natural sexual stimulation to work. Remember, the physiological cascade we just discussed. The entire process begins with arousal. which is required to release that initial spark of nitric oxide.
Without arousal, there is no nitric oxide.
Exactly. And without nitric oxide, there is no CGMP produced for the medication to protect.
So if there's no initial spark, the medication has literally nothing to amplify.
Precisely zero effect. A person could take a PDE5 inhibitor and then sit down to balance a complicated spreadsheet, engage in a stressful argument, or shovel snow in the driveway, and nothing would happen in that specific localized tissue.
Right.
The drug requires the psychological and physical input of arousal to activate the downstream mechanism. It's a multiplier of a natural process, not an initiator.
That structural reality takes a lot of the anxiety and mystery away from how the medication actually operates. But as we dig deeper into the iMedix database, we hit this massive regulatory paradox, and it's something that requires pretty careful examination.
The approval status.
Yes, because sildenafil, the active chemical ingredient itself, is a thoroughly tested, globally recognized, FDA-approved medication. We know the mechanism works. Yet the specific iMedix page for this Viagra Super Active formulation explicitly lists its drug status as not approved.
Yes, it does.
So how does the medical and regulatory community reconcile an approved, proven chemical existing inside an unapproved drug?
It requires a close look at how pharmaceutical regulation actually functions. When a massive pharmaceutical company like Pfizer, in the case of the original Viagra, develops a new chemical entity, they patent that specific rigorous formulation.
Right, the exact recipe.
Exactly. They spend years and hundreds of millions of dollars proving to regulatory bodies like the FDA, not just that the chemical works, but that their specific hard blue pill delivers it safely, consistently, and without toxic degradation over time.
But patents expire.
They do. And when those patents eventually expire, other manufacturing companies are legally allowed to produce generic versions of that chemical.
But they can't just mix the chemical in a bathtub and start selling it. There have to be hurdles to clear to get that generic label, right?
The hurdles are steep. To gain approval, a generic manufacturer must prove bioequivalence.
Bioequivalence.
Yes. They must demonstrate through clinical data that their generic pill acts in the exact same manner, at the exact same speed, and with the exact same metabolic profile as the original patented drug.
I see where this is going.
Viagra Super Active represents what we classify as a non-standard or unapproved generic. A manufacturer has taken the known active ingredient sildenafil, but they have fundamentally altered the delivery mechanism by placing it into this liquid core softgel.
And because they altered the delivery to make it super active and faster absorbing, it is no longer bioequivalent to the original pill. It behaves completely differently in the body.
Precisely. By changing the pharmacokinetic profile, meaning how fast it absorbs into the blood, how it interacts with stomach acids, and how quickly it peaks, they have created an entirely new drug profile.
Wow.
However, they have chosen not to put this specific new liquid formulation through the rigorous, incredibly expensive clinical trials required by the FDA or the European Medicines Agency to actually prove its safety and efficacy.
Because it's too expensive for them.
Most likely. Because it hasn't passed those independent, stringent tests, it lacks the official regulatory stamp. It legally must be classified as not approved.
So a patient considering this is essentially stepping outside the protective umbrella of regulated medicine. I mean, they might be getting the right core chemical, but they're receiving it in a delivery vehicle that just hasn't been independently crash tested.
That's a good way to put it.
No regulatory body has verified the manufacturing quality, the exact dosage suspended in that liquid core, or the safety of the specific gelatins and fillers being used to stabilize it.
It introduces an immense variable of unknown risk. When you bypass regulatory oversight, you are placing absolute blind trust in the ethical standards of an unverified manufacturing facility. This perfectly illuminates why patient safety, extreme vigilance, and deep health literacy are so critical when encountering non-standard formulations.
This naturally leads us to look at the actual scope of treatment. If someone is seeking out a medication with this specific mechanism of action, who is it actually intended for? What are the legitimate, medically sound uses?
Well, the iMedix documentation is very clear. This class of drug is prescribed for adult men diagnosed with erectile dysfunction, commonly referred to as ED.
But ED is a broad umbrella term. It isn't just one isolated malfunction. It's frequently a symptom, right? Like a distress signal indicating a variety of potential underlying systemic issues.
A physician viewing a patient presenting with ED is often looking at the tip of a much larger physiological iceberg. Right. The medical sources categorize the root causes into three primary areas, and understanding them is vital. The first and most critical category involves physical causes. The human vascular system is an intricate, highly interconnected network.
The plumbing system.
Exactly. The blood vessels supplying the erectile tissue are remarkably small in diameter. Because of their microscopic size, they are incredibly sensitive and are frequently the very first vessels in the entire body to show signs of endothelial damage from broader systemic diseases.
So, long before a patient experiences a major cardiac event, these smaller vessels might start failing.
They act as a physiological canary in the coal mine. Conditions like undiagnosed type 2 diabetes, chronic hypertension, and broader cardiovascular disease actively damage the inner lining of the blood vessels throughout the body. They restrict elasticity and reduce natural blood flow.
So, in these physical cases, sildenafil acts as a localized intervention to sort of temporarily overcome that severe physical restriction.
Yes, it forces the vessels to open despite the damage.
Okay, then we have to consider the psychological factors. While prepping for this deep dive, I spent some time reading through the active community forums on the iMedix platform. There was a post from a user named Pocase asking some very vulnerable questions about the intersection of anxiety, stress, and physical function.
It's a very common concern.
It really is. It highlights how the brain is arguably the most critical component of this entire system. If a person is trapped in a loop of psychological stress, the physical plumbing simply refuses to cooperate, regardless of how healthy the blood vessels actually are.
The neurology behind that is fascinating. The human body operates with two main branches of the autonomic nervous system.
Okay.
You have the parasympathetic nervous system, which controls rest, digestion, and sexual arousal.
Rest and digest.
Right. And then you have the sympathetic nervous system, which controls our fight or flight survival response. When a person experiences severe stress, anxiety, or performance pressure, the sympathetic nervous system floods the body with adrenaline and noradrenaline.
The panic chemicals.
Exactly. These survival chemicals actively and aggressively constrict blood vessels. They effectively shut down the arousal process to divert blood to the major muscle groups for survival.
So the brain literally perceives the anxiety as a physical threat, like a tiger in the room, and overrides the reproductive system to just focus on staying alive.
And this creates a devastating psychological loop. If a man experiences ED once, perhaps due to temporary exhaustion or just a stressful day, he may develop profound performance anxiety anticipating the next encounter.
And that very anxiety triggers the fight or flight response.
Yes, which floods the system with adrenaline, which physically causes the ED again. It becomes a self-fulfilling, neurologically enforced prophecy.
That sounds incredibly frustrating.
It is. In these specific cases, a PDE5 inhibitor can serve as a vital bridge. By providing overwhelming physiological support to keep the vessels relaxed despite the adrenaline, it helps break that neurological anxiety loop. It gives the patient the successful experience needed to regain confidence and eventually return to normal unassisted function.
The third category mentioned in the literature is post-surgical ED. I imagine this relates to the physical trauma of necessary medical procedures.
Primarily, it involves recovery from radical prostatectomies or severe pelvic trauma. The nerves and microscopic blood vessels that control erectile function are bundled incredibly close to the prostate gland.
So even if the surgeon is careful,
Even with nerve-sparing surgical techniques, the trauma of the surgery itself can cause temporary or permanent damage to that delicate network. In these recovery scenarios, urologists will often prescribe sildenafil as part of a structured penile rehabilitation protocol.
rehabilitation protocol.
Yes, essentially forcing blood flow to the tissue to prevent atrophy and scarring while the nerves slowly attempt to heal. But again, this is highly specialized and must always be under strict, continuous medical guidance.
When we look at all three of those categories, whether it's compensating for vascular disease, breaking an adrenaline-fueled anxiety loop, or rehabilitating surgical trauma, the medication is stepping in to perform a very specific mechanical override. It is not fundamentally healing the body.
What's fascinating here is that it is the ultimate example of treating a symptom rather than curing a disease. The medication offers temporary localized relief. But true, long-term management of erectile dysfunction demands a drastically more holistic approach from both the patient and the physician.
Right, because if the underlying cause of the ED is undiagnosed diabetes or severe uncontrolled hypertension, relying on a pill to foist temporary vasodilation is akin to ignoring a structural fire in your house just because you managed to temporarily turn off the smoke detector.
That is exactly right. A holistic treatment plan is medically non-negotiable. It requires actively investigating and addressing the broader cardiovascular health. It means running panels to check for endocrine issues like clinically low testosterone or thyroid imbalances.
Fixing the root cause.
Yes. It involves engaging in dedicated psychological counseling to unpick the roots of chronic stress, depression, or complex relationship dynamics, and it requires immense commitment to lifestyle modifications.
Like diet and exercise.
Diet, exercise, and we are talking about aggressive smoking cessation, because nicotine is one of the most potent vasoconstrictors legally available and actively works against the medication. It requires rigorous weight management to naturally improve endothelial health. The medication is merely a supportive tool designed to maintain a patient's quality of life while they undertake the genuinely hard work of repairing their foundational health.
The requirement for underlying health brings us to a really dark and pervasive side of this medication's cultural footprint. The recreational use and the absolute myth of enhancement.
Yes, this is critical.
The iMedix documentation contains a severe, highlighted warning regarding this behavior. Utilizing this medication without a diagnosed clinical medical need, simply for the pursuit of recreational enhancement, is not only dangerous, it is medically indefensible.
It introduces an entirely unnecessary vector of risk into a healthy system. The human body operates on the principle of homeostasis, a constant, delicate internal balancing act. If a healthy young man with fully optimal natural erectile function ingests a powerful PDE5 inhibitor, the drug does not magically elevate him beyond baseline human biology.
It doesn't give him superpowers.
It does not enhance overall sexual performance, it does not artificially increase stamina, and it does not prolong an erection beyond what is naturally dictated by the cessation of arousal.
So a healthy person taking this isn't getting an enhancement effect at all. They're just exposing their internal organs to a powerful chemical for zero actual physiological gain. You are forcing your cardiovascular system to manage significant blood pressure alterations for absolutely no medical reason.
Furthermore, the psychological danger is immense. We discussed the anxiety loop earlier. Healthy individuals who misuse these drugs recreationally frequently develop a severe psychological dependency.
But they feel they need it to perform.
Yes. They begin to associate the ritual of taking the pill with success. Over time, they lose confidence in their own natural, unassisted physiological responses. They can literally induce a state of psychological ED where absolutely none existed before, simply because they convinced their brain they required a chemical crutch.
It masks actual health, distorts psychological confidence, and invites a host of side effects.
Exactly.
And if someone is seeking this drug for recreational use, or if they're desperate for a quick fix without wanting to have a vulnerable conversation with their doctor, they often turn to the internet. Here's where it gets really interesting, because this is where the not approved status of Viagra Super Active becomes incredibly dangerous.
Because it operates outside the system.
Right. Because it isn't regulated, it thrives in the gray market and the outright black market. If a person buys this rapid-absorbing liquid softgel from an unverified online pharmacy, what is the actual reality of what they might be putting into their bloodstream?
The realities of the global counterfeit pharmaceutical supply chain are staggering and deeply terrifying. When you purchase an unapproved drug outside of a licensed, strictly regulated pharmacy environment, you are bypassing every single safety mechanism designed to protect your internal organs.
Right.
Criminal syndicates that manufacture and distribute counterfeit medications like a fake Viagra Super Active do not have a vested interest in your cardiovascular health. Their sole focus is maximizing profit margins and ensuring repeat illicit business. To guarantee that repeat business, they need the unsuspecting user to feel something when they take the pill to convince them it is potent.
So if they aren't using the expensive actual sildenafil chemical, how do they trick the user into feeling an effect?
Forensic analysis of seized counterfeit drugs frequently reveals the presence of undisclosed, highly dangerous stimulants, including various forms of amphetamines.
Amphetamines. Wait, why would a counterfeiter put a powerful central nervous system stimulant into a drug that is supposed to be designed for localized vasodilation? That makes no sense.
It is entirely about creating a false sensation of immediate, overwhelming efficacy. If a user takes the counterfeit capsule, their heart rate immediately spikes, their central nervous system goes into overdrive, and they feel a massive rush of manic energy.
And they misinterpret that.
A user without medical knowledge might completely misinterpret that dangerous stimulant high, thinking, wow, this superactive formulation is incredibly powerful and fast-acting, when in reality, they have just ingested an undisclosed dose of speed.
That is horrifying. And even if they do try to include a PDE5 inhibitor, they probably aren't using the precise, refined chemical, right?
They frequently use whatever chemical analog is cheapest on the black market that week. They might haphazardly mix in raw tadalafil or vardenafil, often in wildly inaccurate and fluctuating dosages. One capsule might have zero active ingredient, while the next capsule in the same blister pack might contain a massive toxic overdose.
Wow.
When you ingest unregulated massive doses of these inhibitors, it can trigger severe erratic cardiac arrhythmias and catastrophic drops in systemic blood pressure.
And the danger isn't limited to the active chemicals either. A softgel capsule has to be filled with something to give it volume and weight. The iMedix page lists some of the inactive fillers discovered by investigators, and it reads like a list of industrial waste.
Because pharmaceutical-grade inactive ingredients, the safe binders and gelatins used in legitimate medicine, are expensive and heavily tracked, counterfeiters substitute them with whatever cheap bulk powders they can acquire anonymously.
Which is what?
Investigators routinely dismantle counterfeit operations and find the capsules filled with commercial talcum powder, raw industrial starch, finely ground drywall dust, and heavily contaminated binding agents.
Drywall dust. Are you serious?
Sadly, yes. Because these operations occur in highly unsanitary, unregulated environments, often literally in garages or abandoned warehouses, the drugs are frequently contaminated with heavy metals like lead, arsenic, and mercury, as well as toxic molds and industrial solvents.
So a patient trying to discreetly treat a vascular issue could end up swallowing a liquid capsule of heavy metals and drywall dust.
Ingesting these substances bypasses your body's external defenses. It can lead to severe, immediate gastrointestinal distress, massive systemic allergic reactions, and over time, cumulative, irreversible damage to the filtration systems of the kidney and the liver. And, tragically in many cases, the capsules contain absolutely zero active ingredients of any kind.
A complete placebo made of toxic chalk.
Aside from the financial scam, this is medically dangerous because it actively delays proper medical treatment. If a patient takes a counterfeit pill that does nothing, they might assume their ED is untreatable, preventing them from seeking the medical intervention that could uncover the severe cardiovascular disease that is actually causing the symptom.
This makes the ability to identify legitimate medication absolutely critical. iMedix provides some very specific authenticity verification methods. For a patient who has a legitimate prescription and wants to ensure the medication in their hand is safe, what should they be looking for? The physical inspection of that amber softgel seems to be the first line of defense.
Physical scrutiny is essential. Legitimate pharmaceutical-grade softgels are manufactured under microscopic tolerances in multi-million-dollar facilities. If you hold an authentic amber liquid core softgel and apply very gentle pressure, the liquid inside should feel perfectly smooth, viscous, and entirely uniform.
Uniform texture.
Yes. If you feel microscopic granules, if the liquid appears cloudy or opaque when held to the light, or if you can see a physical separation of ingredients inside the capsule, it is almost certainly counterfeit.
The imprinting on the capsule itself is also a major tell, right? Counterfeiters might be able to copy the shape, but replicating the precision printing is much harder.
Exactly. The dosage information, such as the numbers 50 or 100 stamped onto the gelatin, should be razor sharp, perfectly aligned, and completely legible. Counterfeit manufacturing utilizes inferior printing technology, resulting in smudged ink, uneven or flaking coloring, or text that easily rubs off.
Good to know.
You should also closely examine the physical seams of the softgel itself. Legitimate capsules are perfectly sealed. If there are slight leaks, sticky residue, or uneven edges along the seam, discard it immediately.
You should also look at the packaging. Genuine products utilize sophisticated anti-counterfeiting measures, like specialized holographic seals and deeply embossed batch numbers that you can actually verify against manufacturer databases or with a licensed pharmacist.
Correct.
If the foil backing of a blister pack feels unusually flimsy, if it tears jaggedly rather than popping cleanly, or if there are glaring spelling errors in the medical insert, you are looking at a dangerous fake.
But the ultimate, most effective verification method has nothing to do with examining the pill. It is entirely about controlling the source.
Right, where you buy it.
You should only ever procure prescription medications from a fully licensed, state-verified, heavily regulated pharmacy that legally requires a consultation and a prescription from a licensed physician. If an internet storefront is offering to ship you Viagra Super Active rapidly, with no prescription required and no doctor's oversight, you are not finding a convenient loophole.
You're finding a trap.
You are willingly walking into the epicenter of the counterfeit danger zone. The slight convenience of avoiding a doctor's visit is never worth the risk of ingesting undisclosed amphetamines or heavy metal neurotoxins.
Assuming the listener has navigated all of this perfectly, they have consulted their physician, addressed their underlying health, and obtained a verified, legitimate prescription from a safe pharmacy, we now have to navigate the complex web of chemical interactions and lifestyle factors.
There are many.
The iMedix database features a severe black box equivalent warning that we really need to unpack thoroughly.
This is the most critical safety protocol regarding sildenafil. The absolute, strict, non-negotiable contraindication is the concurrent use of this drug with any form of nitrates.
Nitrates.
Yes, nitrates are a powerful class of medications typically prescribed by cardiologists to manage severe chest pain, known as angina. Common pharmaceutical names include nitroglycerin, isosorbide dinitrate, or isosorbide mononitrate.
Okay, so heart medication.
Yes. And this catastrophic interaction also heavily applies to the illicit recreational inhalants, commonly known on the street as poppers, which are formulations of amyl nitrite or butyl nitrite.
We need to explain exactly why this specific combination is so uniquely deadly. If a patient takes their prescribed angina medication and then takes a sildenafil softgel, what is happening on a cellular level that causes such a violent clash?
It connects directly back to the foundational mechanism of action we outlined earlier. Sildenafil works by forcing localized vasodilation. It inhibits the enzyme that allows blood vessels to constrict, forcing them to remain relaxed and widened. Nitrates operate on a similar but systemic principle. They are incredibly potent system-wide vasodilators. Their entire medical purpose is to rapidly open up the constricted blood vessels around the heart to relieve the crushing pain of angina.
So you have two different chemicals, both shouting at the body's vascular system to open the floodgates as wide as possible.
Precisely. When you combine them, the effects don't just add together, they multiply exponentially. You hit the cardiovascular system with a massive, uncontrolled double dose of extreme vasodilation.
And what happens then?
The blood vessels throughout the entire body dilate so wide and so rapidly that the systemic blood pressure plummets to critical life-threatening levels.
And the immediate mechanical consequence of that massive pressure drop is that the heart can no longer generate enough force to push blood against gravity up into the brain or into the vital organs.
The clinical term is severe, refractory hypotension. The brain is instantly starved of oxygenated blood, leading to immediate syncope or fainting. The heart, desperately trying to compensate for the lack of pressure, beats wildly out of control.
That is terrifying.
In most severe cases, this extreme lack of blood flow starves the cardiac muscle itself, triggering a massive myocardial infarction, a heart attack, or causing an ischemic stroke due to the lack of cerebral blood flow. This interaction is so universally dangerous that emergency room protocols require doctors treating acute chest pain to explicitly ask the patient if they've ingested any PDE5 inhibitor within the last 24 to 48 hours.
And if they have.
If the answer is yes, the doctors are medically barred from administering life-saving nitroglycerin. It is a fundamentally fatal chemical combination.
That is an incredibly sobering reality, and it's just the ultimate argument against casual self-medication. A patient might look at their pill organizer and not realize that their heart medication and their ED medication are on a catastrophic collision course.
Exactly.
Beyond the absolute prohibition of nitrates, what other pharmaceutical interactions require serious clinical caution?
The landscape of drug interactions is highly complex. Let's look at alpha blockers. Medications like tamsulosin or doxazosin are frequently prescribed to older men to treat benign prostatic hyperplasia or an enlarged prostate.
Okay.
These drugs work by relaxing the muscles around the prostate and the bladder neck, but a secondary effect is that they also systematically lower blood pressure.
So another clash with the vasodilation.
Yes. If a patient ingests an alpha blocker and sildenafil concurrently, they risk a severe additive hypotensive effect. The combined blood pressure drop can easily lead to severe orthostatic dizziness or fainting, particularly when standing up.
So they shouldn't be taken together at all.
Urologists will typically mandate the patient separate the dosing of these two medications by an absolute minimum of 4 to 6 hours to allow the vascular system to stabilize.
I am also looking at a section in the iMedix documentation regarding CYP3A4 inhibitors. That looks like a randomly generated password. What exactly is CYP3A4 and why does it dictate how this medication functions?
CYP3A4 is a vitally important piece of human anatomy. It is a specific, highly active enzyme produced primarily in your liver and your intestines.
The liver.
Yes. You can visualize the liver as the body's central chemical filtration and dismantling plant. The primary job of the CYP3A4 enzyme is to identify foreign molecular compounds in the bloodstream. including pharmaceutical drugs like sildenafil, and metabolize them. It breaks the drug down into inert waste products so that the body can safely excrete them, clearing the drug from your system.
So this enzyme is the reason a drug effect eventually wears off. It's actively chewing up the chemical over time.
Precisely. However, certain heavy-duty medications act as CYP3A4 inhibitors. They chemically bind to this liver enzyme and essentially turn it off.
Turn off the filtration plant.
Yes. Common culprits include powerful systemic antifungals like ketoconazole, certain macrolide antibiotics like erythromycin, and particularly potent antiviral regimens like HIV protease inhibitors such as ritonavir.
If a patient is taking one of those inhibiting drugs, their liver's filtration plant is basically shut down. So when they take the sildenafil softgel, the body has no way to break it down and clear it out.
The drug becomes trapped in the circulatory system. Because the normal metabolic exit routes are blocked, the concentration of sildenafil in the blood plasma rises dramatically and stays elevated for vastly extended periods. This exponential increase in concentration massively amplifies the risk of severe toxicity and catastrophic side effects.
The body is essentially overdosing on a standard pill because it can't flush it.
For patients requiring these specific enzyme-inhibiting medications, physicians must heavily restrict the sildenafil dosage. They will frequently cap the absolute maximum dose at 25 milligrams daily, or in the case of HIV protease inhibitors, restrict it to just 25 milligrams every 48 hours to prevent toxic bioaccumulation.
That makes total sense.
And it should go without saying, a patient must never, under any circumstances, combine sildenafil with other PDE5 inhibitors like tadalafil or vardenafil. Stacking these drugs does not improve efficacy. It merely multiplies the enzymatic inhibition, guaranteeing a severe medical emergency.
We've covered the heavy pharmaceutical clashes, but what about the seemingly mundane variables?
Yeah.
Food, beverages, herbal supplements. I was genuinely surprised by how easily everyday diet can sabotage the advanced mechanics of this specific liquid core medication.
Diet plays a huge role.
The iMedix guidelines specify that while you can take Viagra Super Active with food, a patient needs to be highly aware of the fat content of their meal.
The interaction with dietary fat directly undercuts the entire marketing premise of the superactive formulation. The liquid core is specifically engineered for rapid gastric absorption.
The glass of water analogy from earlier?
Exactly. However, the human stomach regulates how quickly it empties its contents into the small intestine based on what it is digesting. If you swallow that advanced soft gel immediately after consuming a heavy, high-fat meal, perhaps a large, heavily marbled steak, a greasy burger, or rich, heavy cheeses, the stomach identifies the complex fats and drastically slows down the digestive process to break them down.
The stomach basically locks the exit doors to deal with the heavy meal, and the medication gets trapped in the waiting room.
Gastric emptying is severely delayed. The liquid medication remains trapped in the stomach acid mixed with the dietary fat, and its absorption into the bloodstream can be delayed by a massive 1 to 2 hours.
Which defeats the entire purpose.
If a patient has paid a premium for the rapid onset capability of this superactive softgel, consuming a high-fat meal completely neutralizes that pharmacological advantage. It forces the rapid drug to behave like a slow, conventional tablet.
Then there is the fascinating, slightly bizarre interaction with grapefruit juice. I feel like grapefruit juice constantly appears as the unexpected villain in so many pharmacological stories. How does a simple breakfast beverage interfere with a highly synthesized chemical?
It connects directly back to the CYP3A4 liver enzyme we just discussed.
Oh, really?
Yes. Grapefruit juice and the fruit itself contains high concentrations of organic chemical compounds called furanocoumarins. These natural plant compounds are potent inhibitors of the CYP3A4 enzyme located in the intestinal wall and the liver.
So drinking a glass of grapefruit juice does the exact same thing to your liver as taking a heavy HIV protease inhibitor.
On a slightly lesser scale, yes. The furanocoumarins bind to the enzymes and shut down the body's ability to metabolize the sildenafil. By inadvertently blocking the filtration system with a breakfast drink, a patient causes the drug's concentration in their blood to spike, making severe side effects significantly more likely.
That is wild. And if grapefruit juice acts as an enzyme blocker, keeping the drug in the system, we have to look at the other extreme. The iMedix page highlights herbal supplements, like St. John's wort. This popular mood supplement seems to do the exact opposite to the liver.
St. John's wort is a classic example of an enzyme inducer. Rather than shutting the liver down, the active compounds in St. John's wort kick the CYP3A4 enzymes into massive overdrive.
Overdrive.
The liver begins metabolizing and filtering chemicals at an accelerated, highly aggressive rate. If a patient takes sildenafil while heavily supplementing with St. John's wort, their supercharged liver clears the medication from the bloodstream incredibly fast. It strips the chemical out so quickly that the drug's efficacy is reduced to near zero.
The patient might mistakenly believe the medication is defective or their condition is worsening, when in reality their herbal tea is just rapidly flushing the active ingredient into their bladder before it has a chance to reach the localized tissue.
We also must address the ubiquitous presence of alcohol. A glass of wine or a cocktail might seem culturally intertwined with the concept of a romantic evening, but the clinical guidelines are exceptionally strict about limiting alcohol consumption when utilizing PDE5 inhibitors.
Because alcohol is fundamentally a central nervous system depressant and a vasodilator itself, correct?
It is. Alcohol relaxes blood vessels and lowers systemic blood pressure. Combining alcohol with sildenafil creates another additive hypotensive effect.
Just like the alpha blockers.
Yes. It significantly worsens dizziness, drastically increases the risk of orthostatic hypotension when moving from a seated to a standing position, and puts completely unnecessary physiological strain on the heart as it attempts to maintain cardiac output against two different vasodilating chemicals.
This entire section really forces a shift in perspective. We tend to view our bodies as simple machines. You insert a chemical input and you get a predictable, isolated output. But this reveals that the human body is a massively complex, highly reactive ecosystem. A heavy meal, a glass of citrus juice, an over-the-counter herbal supplement, every single mundane variable dramatically alters how this powerful chemical behaves as it navigates your internal systems.
It is a profound reminder of biological interconnectivity. You cannot isolate a chemical reaction within a living organism.
Which provides a seamless bridge into our final major area of exploration: side effects. We have discussed how to identify fakes and avoid catastrophic interactions, but even under absolutely perfect, clinically supervised conditions, utilizing a pure medication, side effects occur. The body reacts. Let's examine the common everyday effects first. They seem to be direct, unavoidable consequences of the mechanism of action: headache, flushing or intense redness in the face, general indigestion, and nasal congestion.
These are the classic hallmarks of systemic vasodilation. The sildenafil chemical is incredibly efficient in targeting the PDE5 enzyme, but it is not perfectly microscopic in its targeting. When the drug enters the systemic bloodstream, it circulates everywhere.
Right.
The PDE5 enzyme isn't exclusively located in the pelvic region. It is also present in the smooth muscles of the vascular tissue throughout the body, including the capillaries in your face, the blood vessels in your nasal passages, and the smooth muscle lining of the gastrointestinal tract.
So when the drug blocks the enzyme locally to create the desired effect, it's also slightly blocking the enzyme everywhere else.
Correct. The capillaries in your face dilate, causing a flush of hot blood, leading to redness and headaches. The blood vessels in your nasal mucosa dilate and swell, restricting airflow and causing a feeling of severe congestion without any actual mucus.
Ah, so that's why you get stuffed up.
Yes. And the smooth muscles in your stomach relax abnormally, allowing stomach acid to creep up into the esophagus, causing indigestion or acid reflux. These are generally mild and temporary as the vascular system adjusts to the chemical presence, but they are a direct reflection of the drug's mechanism echoing throughout the body.
But the iMedix database details some side effects that are far beyond a simple headache. Some of the most fascinating and frankly bizarre reactions are visual. A small but significant percentage of users report transient blurred vision, acute sensitivity to bright light, or, most strangely, a very specific blue or blue-green tint overlaying their entire field of vision.
The blue-tinted vision is a remarkable, highly specific quirk of our cellular biochemistry. While sildenafil is engineered to primarily target and inhibit the PDE5 enzyme, its molecular structure allows for a slight, unintended cross-reactivity with a totally different enzyme known as PDE6.
What is PD6 and where does it live?
PDE6 is an enzyme heavily concentrated within the photoreceptor cells of the human retina, specifically the rod and cone cells that line the back of the eye, and are responsible for capturing light and processing color signals to the brain.
In the eye.
Yes. When a systemic dose of sildenafil inadvertently inhibits a fraction of the PDE6 enzymes in the retina, it temporarily disrupts the electrical cascade that processes visual input. It specifically alters the threshold for how the retina processes light on the blue-green spectrum.
So the patient's eyes are structurally fine, but the chemical is briefly scrambling the color processing software in the retina, making the world look like it has a blue cinematic filter over it.
It is usually mild, transient, and resolves completely as the drug is metabolized, but it is a stunning example of how a microscopic overlap in enzyme structure can link the vascular system in the pelvis directly to color perception in the eye.
While blue vision is a fascinating anomaly, the iMedix documentation pivots to outline critical, life-altering medical emergencies. These are the rare events that require a patient to immediately bypass their primary doctor and head straight to a hospital emergency room. The first is a condition that strikes primal fear into anyone who understands the physiology: priapism. We need to explain exactly what this is and why it represents such a severe medical crisis.
Priapism is clinically defined as a rigid, painful, and persistent erection that lasts continuously for longer than 4 hours, completely independent of sexual arousal or stimulation. To understand the severe danger, you must look at the physical reality of the tissue. An erection is created by trapping blood within the expandable chambers of the penis.
Right.
Under normal, healthy physiological conditions, that blood is constantly cycling, maintaining oxygenation. However, in the event of priapism, the exit valves remain clamped shut. The blood is trapped in a completely closed system for hours.
And blood that isn't circulating rapidly loses its oxygen supply.
The trapped blood becomes profoundly deoxygenated and highly acidic. The delicate erectile tissue is literally starved of oxygen. If the trapped blood is not surgically drained or chemically reversed by an emergency room physician within that critical window, the oxygen starvation triggers localized tissue death necrosis.
The tissue begins to die from the inside out.
And as the tissue dies, it is replaced by rigid, inelastic scar tissue. Untreated priapism can cause irreversible permanent damage to the physical structure, leading to severe, lifelong, untreatable erectile dysfunction. It transforms a temporary symptom management tool into a permanent disability.
The iMedix outline makes a very specific note that while this condition is incredibly rare in the general population, the risks are significantly magnified for men suffering from underlying hematologic or blood-based conditions. They specifically list sickle cell anemia, leukemia, and multiple myeloma. Why do these specific blood disorders turn a rare risk into a highly elevated danger?
Those hematologic conditions fundamentally alter the physical architecture, the thickness, or the clotting behavior of the blood cells themselves. Let's look at sickle cell anemia as the primary example.
Okay.
In a patient with this condition, genetic factors cause the normally round, flexible red blood cells to become rigid, sticky, and shaped like crescent moons or sickles. When sildenafil forces rapid vasodilation and a massive rush of blood enters the microscopic vessels of the erectile tissue, those rigid, abnormally shaped sickle cells can physically jam together and interlock like a log jam in a narrow river.
They physically barricade the exit vessels.
They create a structural blockade. Even when the drug wears off and the PDE5 enzyme tries to constrict the vessels to drain the blood, the physical jam of sickle cells makes it structurally impossible for the blood to flow back out. The erection becomes permanently trapped, accelerating the timeline toward tissue necrosis. Patients with these blood dyscrasias must approach PDE5 inhibitors with extreme, highly monitored clinical caution.
Another critical emergency highlighted in the text involves sudden, catastrophic sensory loss. We discussed the mild, temporary blue tint to the vision earlier, but this is a completely different, infinitely more severe event. It is referred to by the acronym NAION.
NAION stands for non-arteritic anterior ischemic optic neuropathy.
That is a mouthful.
It is. It is an exceptionally rare but entirely devastating risk. Unlike the temporary scrambling of the PDE6 enzyme, NAION involves a sudden catastrophic loss of blood flow ischemia to the optic nerve itself.
The optic nerve.
Yes, the optic nerve is the massive data cable connecting the eye to the brain. When it is starved of blood, the nerve fibers die rapidly. This results in sudden, painless, and often permanent, irreversible vision loss in one or both eyes.
Is this directly caused by the drug, or is it a combination of factors?
The exact causal mechanism linking PDE5 inhibitors directly to NAION is still heavily debated and intensely studied within the medical and ophthalmological communities. However, the data clearly shows a correlation. The primary risk factors heavily involve patients whose vascular systems are already severely compromised.
Such as?
Individuals who already suffer from advanced diabetes, chronic hypertension, high systemic cholesterol, or who have a long history of heavy smoking have blood vessels that are incredibly fragile and prone to microscopic blockages.
So, if a fragile, compromised blood vessel feeding the optic nerve is subjected to the sudden blood pressure shifts caused by the medication, it might simply collapse or clot off.
That is the leading clinical theory. Similarly, there are documented reports of patients experiencing sudden, profound sensorineural hearing loss, often accompanied by severe tinnitus, a deafening ringing in the ears, and intense vertigo following the ingestion of the drug.
Hearing loss, too.
Yes, the inner ear relies on an incredibly delicate, microscopic blood supply that is equally vulnerable to sudden hemodynamic shifts. The absolute clinical mandate is that if a patient experiences any sudden, unexplained change or loss in their vision or their hearing, they must instantly discontinue the medication and seek emergency medical intervention.
And finally, we must address the overarching risk of sudden cardiovascular collapse. We explored the fatal interaction with nitrates, but even if a patient is entirely clear of conflicting medications, if they have severe pre-existing cardiovascular disease, such as a history of unstable angina, severe arrhythmias, or a recent myocardial infarction within the preceding 6 months, the mere physical reality of the situation poses a threat.
It is a vital, undeniable reminder that physical capacity dictates the baseline safety of this medication. The drug itself causes significant immediate shifts in systemic blood pressure and cardiac output. When you combine those chemically induced shifts with the intense physical exertion, elevated heart rate, and massive adrenaline spikes associated with sexual activity, it can simply overwhelm a weakened or recently damaged heart muscle, triggering a fatal cardiac event. The medication might facilitate the mechanical process, but it cannot reinforce a failing cardiac engine.
This incredible litany of physiological variables, chemical interactions, and systemic risks perfectly eliminates why clinical dosing is not a one-size-fits-all scenario. Special populations require highly specific, careful dosing adjustments. A healthy adult male might start at a standard 50 milligram dose, but the iMedix database outlines very clear physiological reasons why specific demographic groups must drastically alter that intake. Let's look at the elderly population, generally defined in these clinical parameters as anyone 65 years of age and older. The recommendation is to severely lower their starting dose, often down to 25 milligrams. Why does age change the pharmacology so significantly?
It fundamentally comes down to the body's natural decline in metabolism and chemical clearance rates. As a human being ages, the efficiency of their internal filtration organs, specifically the liver and the kidneys, naturally and unavoidably decreases.
They just don't work as fast.
The blood flow to the liver slows, and the volume of active metabolizing enzymes drops. For a healthy 30-year-old man, a standard 50 milligram dose is metabolized and cleared from the bloodstream on a predictable, rapid curve. However, for a 75-year-old man, his liver and kidneys process that exact same chemical significantly slower.
So a standard dose in an older body essentially acts like a massive overdose because the chemical stays in the blood plasma far longer than intended.
The half-life of the drug is extended. If an elderly patient takes the standard dose, they are exposed to vastly higher systemic concentrations of the chemical, drastically increasing their risk of experiencing severe hypotension, syncope, or the visual and cardiac side effects we discussed. Lowering the dose to 25 milligrams ensures they achieve the desired localized efficacy without overwhelming their slower filtration systems.
The exact same logic applies to individuals suffering from clinical liver disease, but the iMedix documentation gets very specific here. They reference something called the Child-Pugh scoring system. If a listener hasn't encountered this specific medical jargon before, what exactly is the Child-Pugh score, and how does it dictate who can and cannot take this medication safely?
The Child-Pugh score is an incredibly important clinical tool. It is essentially a standardized grading scale that hepatologists and gastroenterologists use to evaluate the exact severity of a patient's chronic liver disease or cirrhosis.
It measures the damage.
Yes, it doesn't just look at a single blood test. It assesses multiple critical factors of liver function. It measures total bilirubin levels to see how well the liver clears waste. It measures albumin levels to see how well the liver produces essential proteins. It checks blood clotting times. And it looks for physical symptoms like ascites, which is the severe accumulation of fluid in the abdomen due to liver failure.
It provides a comprehensive report card on the liver's remaining filtration capacity.
Exactly. The system grades the liver function into 3 classes, A, B, and C. If a patient scores a Child-Pugh Class A or Class B, it indicates mild to moderate liver strain. Their liver is damaged, but it's still fundamentally functioning. For these patients, prescribing sildenafil requires immense caution and drastically restricted lower dosing because their clearance rate is severely compromised.
But what if they score a Class C?
A Child-Pugh Class C score indicates severe end-stage hepatic impairment. The liver's cellular infrastructure is massively scarred and functionally failing.
Mm.
For a patient with Class C liver disease, the administration of sildenafil is an absolute total contraindication.
Completely off limits.
Yes. Their liver simply lacks the enzymatic capacity to safely process and metabolize the complex chemical structure of the drug. Ingesting it would lead to immediate, massive toxic bioaccumulation in the bloodstream, triggering systemic organ failure. The drug is completely, unequivocally off limits.
Stepping back and looking at the vast amount of ground we have covered today, we need to synthesize the reality of this deep dive. Viagra Super Active is a profound pharmaceutical paradox. On one hand, it is a highly engineered, rapid-acting, liquid core iteration of a globally recognized, brilliantly effective chemical sildenafil citrate. The mechanism of action is elegant.
It is like
But because of its not approved regulatory status, choosing to navigate its use is akin to deliberately walking through a medical minefield without a map. A patient utilizing this unregulated formulation has to contend with terrifying counterfeit risks in the global black market, severe and often fatal chemical interactions with nitrates and enzyme inhibitors, and a spectrum of physiological side effects ranging from transient blue-tinted vision to permanent tissue necrosis and sudden ischemic blindness. It is a powerful, undeniable tool, but it is a tool that demands deep clinical respect, immense physiological awareness, and absolute medical oversight.
the biochemical elegance of a targeted PDE5 inhibitor is a triumph of modern science. But we must never view it as magic. It is a highly specific mechanical facilitator. It cannot unilaterally rebuild a fundamentally degraded cardiovascular infrastructure, and it cannot magically overwrite the deep-seated neurological reality of psychological anxiety. It is completely reliant on the body's natural foundational biological processes to function at all.
I think bringing it back to the human element is the most important takeaway. When I was reviewing the active community forums on the iMedix platform, looking at users like JustAGuy35 asking if his mid-30s ED is a sign of broader failure, or Pocase asking about the paralyzing grip of performance anxiety, it serves as a stark, powerful reminder. These highly clinical medical challenges are deeply, profoundly human. They are intensely isolating. They carry immense societal stigma, and yet they are shared by millions of people across the globe.
Very shared experience.
That shared vulnerability is exactly why platforms like iMedix exist, to provide this exact kind of comprehensive, deeply educational safety discourse. The goal is to ensure people don't have to navigate these terrifying silent issues in the dark, or worse, turn to highly dangerous, unregulated black market alternatives purely out of embarrassment or a lack of accessible knowledge.
Health literacy is the ultimate empowerment. It provides patients with the vocabulary and the understanding to approach their bodies logically and to have confident, informed, and fearless conversations with their medical providers. And that concept leads me to a final, broader thought I want to leave you with today.
I'd love to hear it.
Throughout this entire deep dive, we have meticulously analyzed the mechanics of a superactive drug. A specific formulation engineered purely to act faster, to circumvent the natural, evolved waiting period of gastric digestion, to ruthlessly optimize the human biological response time. But I want you to consider how our relentless modern cultural pursuit of optimization, efficiency, and immediate gratification often entirely blinds us to the intricate, delicate, and deeply communicative balance of our own biology.
That's a great point.
When we attempt to chemically cheat time with rapid absorption liquid technology, or when fundamentally healthy individuals seek out unregulated recreational enhancement merely to perform like unfeeling machines, we have to ask ourselves a vital question. Are we actually addressing and solving the complex root of our human anxieties and physical frailties? Or are we merely utilizing powerful chemicals to rapidly mute the vital warning signals that our bodies and our minds are desperately attempting to send us?
That is a profound lens through which to view modern medicine. Are we genuinely listening to the intricate ecosystem of our bodies, or are we just obsessively trying to find a faster way to put a piece of tape over the flashing warning lights on the dashboard? Thank you all so incredibly much for joining us on this exhaustive deep dive into the complex world of Viagra Super Active and the invaluable detailed resources provided by the iMedix platform. We truly hope you walk away from this discussion feeling significantly more informed, deeply empowered, and vastly more aware of how powerfully these chemical interventions interact with the beautiful, fragile ecosystem that is your body. Keep asking the hard questions, stay endlessly curious about how the world works, and above all else, stay safe. We will catch you on the next deep dive.